sort of later on down the line for various things. Certainly if you have signs of an infection, if you've got features of a urine infection, so
Yes.
that's also really important to seek help straight away. So if you have a temperature or if it hurts when you go to pass urine or pain, all really important signs to get treatment straight away. And you can see your GP for that or your midwife for that.
Yeah, I think sometimes it's knowing what symptoms to look out for, and that's
Yeah.
the key aspect really of knowing what's normal for you, and if something changes from the norm,
Yeah.
then just to access some help.
Yeah, I mean, the thing is that, as you say, in pregnancy, there are lots of changes that can happen. But things that certainly aren't normal is if you become so breathless you can barely walk.
Yeah.
If you get chest pain that is so severe that you can't do anything with it. If you have a headache that's not getting better with paracetamol, and if you get other symptoms that, are quite severe, just seek help. And do you know what? If you're seen and you're told, actually, this is the diagnosis, it's nothing to worry about, then that puts your mind at ease. But then you also need to know what to look for if things get worse.
So just to reiterate, what we do normally advise is if you have any problems before 16 weeks, particularly if you have any problems before 16 weeks, always access the emergency department. If you are over 16 weeks and you have any of what we call the important symptoms, so as Beryl said, that's things like headaches, blurred vision, epigastric pain, swelling, any bleeding, if your waters break, or if there's a change in your baby's movements, it's really important that you should always contact triage, even if it's just for advice after 16 weeks.
And one of the things I would say about, things like headache, abdominal pain, and certainly movements is your pattern of movements.
Absolutely.
And just because it's okay today and you've been checked today doesn't mean 4 hours down the line or tomorrow. If it's not right, don't just think, I was checked yesterday, it'll be fine.
Yes.
Just come straight back in. And a lot of people worry saying, I don't want to bother anyone. Trust me, I'm a consultant. I want to be bothered. I want to know about these things.
We want to make sure you're safe and that your baby's safe.
Yeah, absolutely.
Definitely. Just off topic slightly, what do you think about people who say, but I checked myself, I've got a Doppler at home?
So the thing is that we just don't know, how accurate that is and what we're actually looking at, because I am not an obstetrician. I look after medical problems, and I am not trained, despite being a trained consultant, to listen to baby's heartbeat, because when I put a probe on, I could be listening to mother's heartbeat.
Yes.
There are so many things we could be listening to, or the placenta,
or echo.
There's lots of noises going on there. So we need someone who is properly trained to do it, and not just do it, but then to act upon it if there is a problem. So please don't be buying devices online to reassure yourselves. One, it's a waste of money, and two, please do leave it to people who are trained to do it. I work and I know the limits of my capabilities, and I will always ask a colleague who is more trained in certain things than me to look, because it's important our women get the best care possible.
Yeah, and it's not worth having that false reassurance.
Yeah.
You've got to be absolutely certain that you're always happy when you're going to bed at night, that everything's okay, and that you're not avoiding going in that night thinking, I've got a midwife appointment in the morning, or I've got to see the consultant tomorrow. You must go in on the same days that you are having the problems. So, regarding physiological changes in pregnancy, what would you describe as normal signs and symptoms?
So I think just firstly what physiological symptoms are. What that just means is symptoms that are normal for pregnancy because the entire body changes.
Yes.
I just think it's absolutely fascinating how a woman's body changes in pregnancy. It is just phenomenal. I think it is just all these changes, every organ from the skin to the bones, to the heart, to the lungs, to the brain, even the eyes, everything changes in pregnancy. And all of this is to ensure that women can grow a baby, but also deliver a baby. So one of the things that happens in the bloodstream is there's lots of things that make up blood, but blood can become a little bit stickier. And as baby grows, that can sometimes block the passage of blood coming back. And as a result, women can develop clots in the legs, which can travel into the lungs. This is called venous thromboembolism. And that can present, and the symptoms can be leg swelling, and pain in the leg, and redness in the leg, and pain to the point where when you stand up on that leg, it's really, really painful. Now, what is normal for pregnancy is leg swelling. So sometimes it can be difficult for women to think, what's the difference between normal leg swelling in pregnancy and a clot in the legs? Well, normal leg swelling in pregnancy, you might get tightness around the legs, but it should be both legs. It shouldn't be painful. It shouldn't be red. So if you get those symptoms, particularly in one leg, again, urgent medical attention through the emergency department, regardless of how pregnant you are. And the other thing that changes is the body's ability and how the mother's ability to breathe. So women in pregnancy breathe deeper. And sometimes a lot of women say, I just feel so starved of air. I feel like I just need to suck air in all the time. And that is because the body breathes in oxygen and breathes out waste products. And in pregnancy, women need to breathe out more of the waste products so those waste products don't go to baby. So it is normal to feel this desire to just suck air in. But women shouldn't be so breathless that they can't sleep at night. They shouldn't be so breathless that they're sat up on lots of pillows just to help them breathe. Wheezing and added sounds in the chest and noisy breathing aren't normal, and not being able to walk because you're so breathless is not normal. So I sometimes see women and they say, do you know what, I'm really, really breathless. And then I fully assess them and, you know, check that they're not anemic, because your blood count and your iron levels can fall in pregnancy. I assess them and check them and say, yes, I know you're really breathless, but I've checked everything and actually this is normal. And that can be reassuring. But I always tell them that actually, if you have those other signs like wheezing or needing to sit up on pillows or being so breathless that you can't walk, that's a problem. So as pregnancy progresses, this desire to suck air in gets bigger.
I think sometimes women say, like, they're having a conversation and they're not even able to talk in a full sentence, and that's quite alarming, because you'll start asking questions, how long has that been going on? But sometimes, the reason I mention that is because sometimes women aren't aware that that is something to be concerned about. So they just think, oh, it's because I'm pregnant, or I am a bit anemic, or maybe they've got asthma sometimes as well.
And I would say is that if you have got something like asthma or any other problem related to breathing, it is really important we control that in pregnancy anyway. That's very, very important. But it is better to get checked out, and it could be that actually, yes, this is normal for pregnancy. But if you are unsure and you are so, like I say, a lot of women, they say, you know what, when I walk, I get breathless. But if your degree of breathlessness is getting worse and worse and worse to the point where you can't do simple things, then it is much better to get checked out and have someone listen to your chest, check your oxygen levels, check your blood tests, and possibly do, you know, a chest x-ray and things like that to look at your chest. All these things we can safely do in pregnancy.
What about people who may already have an existing heart condition or just feel that they've got palpitations? That's something that can be quite normal in pregnancy, but it can also be something that needs investigating.
Yeah, no, that's a really good question. So what I would say, not just for heart conditions, but for any women that have got medical conditions, and I'm sure we're on the same page because I know professionally we are, is that the most important thing if you have got medical conditions is to make sure you have a planned pregnancy. So it is really important to plan your pregnancies, to make sure that your weight is at a good level, that you have your prenatal vitamins, that your vitamin D and folic acid levels are good, and that your medical conditions that you have are well controlled entering into a pregnancy. Because it may surprise you to know that lots of women with medical problems, even severe medical problems, can have pregnancies, but those pregnancies are more likely to be successful and babies are more likely to be well grown to term if those medical conditions are controlled, and, you know, those women work with people like me and obstetricians who look after such women. So I often see people before pregnancy to plan their pregnancies and say, actually, you're doing really well. If you get pregnant, we need to then think about the medicines you're on, because we may need to change them to be more pregnancy friendly. But what I would say is it's important to get advice before stopping medication in pregnancy, because
that was going to be my next question.
So a lot of women will be on medication, but it's really important to control a mum's health and make sure mum is well so she can grow a well-growing baby. But back to your question about palpitations, again, the other thing that happens in pregnancy is the heart tends to beat more forcefully and faster to accommodate all this extra blood that's going around. So it is normal for the heart rate to rise, and it is normal to have this feeling that your heart is beating out of your chest. But to have a fast racing heart rate that is well above 100 with breathlessness, or one that makes you feel dizzy, those aren't normal things. And certainly if there's any chest pain or you feel so dizzy that you're going to black out, those are really important things to be aware of, because again, that's one where you have to go to the emergency department.
What if a lady is worried but friends and family around her are reassuring her? What would you say to those women who are second guessing themselves?
So what I say to women, and I've worked with women for many, many years, is trust your own voice.
Yes, definitely.
And if you feel something isn't right, please seek medical attention. You know, I know there are so many people in the communities and families that are really well-meaning,
Yes.
and they want to be helpful, and they want to, it's very easy to want to reassure someone and make everyone feel better. But it is really, really important because we now have more awareness about things that perhaps we didn't many years ago when certain people went through their pregnancies. So we now have more awareness. We have people like myself, yourself, and other people that are trained to really think about these medical problems as well as all the other obstetric problems that can occur. And actually what we also know, particularly in our community in Walsall and Wolverhampton, is that medical problems and pregnancy-related problems are higher in this part of the region, this part of the country than elsewhere. So we as a community really need to be aware of that and actually say, do you know what, we shouldn't be second-guessing. We should be trusting medical professionals and trusting ourselves, more importantly, and seek advice.
Yeah, and listen to that inner voice. If
Yeah.
you've had a response from somebody, and it could even be a health professional, I guess, if you're not happy with the advice that you've been given, you've got every right to ask for a second opinion, or, you know, can you just support me? I need more information. It's just about asking, isn't it, and making sure that your questions are answered.
I think you've hit the nail on the head in terms of making sure your questions are answered, because sometimes you may be told, okay, this is nothing to worry about, I'm happy, you can go home. And that's okay, but you still need a diagnosis. You still need a diagnosis, and you still then need to know after that, okay, I'm glad everything is fine today, but what do I need to worry about?
Yeah.
So I frequently now have started to educate my women and their families to say, do you know what? You've come in with, let's say, for example, breathlessness. I know in my head as a doctor there are certain things that I must be sure it's not. You know, I must exclude all the serious causes of breathlessness. And sometimes I do that and I'm still thinking, actually, do you know what? Everything is fine today, but I can't explain your symptoms. And sometimes, sadly, that happens. We don't always have an answer first time. That's just the reality of working as a doctor. But I always tell my women now, these are the things, you know, these are the symptoms you've got to look for. If any of these things happen, come back, because the diagnosis may have evolved into something I can now pick up. Because the more I work in medicine, the more I realise that it isn't always straightforward.
Yeah, and sometimes, I mean, I'm speaking as a midwife, you don't always have the answers. So
Yeah.
sometimes women will ask me things and I'll say, okay, tell me all about it. I'll get as much information as I can. And then I will reassure them and I'll say, right, let me find out more about it and then I'll get back to you. Because sometimes it may be that I need to do more learning. And that's okay, we're all human, we're all learning all the time. But make sure you as a patient or a pregnant person, you are reassured, fully reassured, and you get the answers that you need for the concerns that you have.
It's not just yourself. There's times frequently where I'm saying to women, I don't know what this is.
Yeah,
Because sometimes I don't.
that makes me feel better.
No, it happens. And I think you've got to be honest.
Yeah.
I can't,
Yeah.
you know, I'm completely honest with people I work with and say, you know, I don't know what this is, but I know I'm not worried.
Yes.
But sometimes I'll say, well, actually, you know, let's come back and see me at whatever time interval, because things may have evolved into something, or actually I can be reassured that it's normal. It happens all the time.
Yeah.
Because there's never 100% certainty with things, and we have to be honest with people.
Yeah. I think diabetes can be quite concerning for women as well, especially if they've got pre-existing diabetes or ladies that become pregnant and then develop gestational diabetes. So what would your advice be to those diabetic ladies or gestational diabetics?
So the first thing I would say is pre-pregnancy planning is really important. So the things that are really, really helpful here is to make sure your diabetes is really well controlled, and that you really engage with your health services to control your diabetes. And I really encourage my women, with all women, but particularly those with blood pressure issues and diabetes, exercise and weight control. Those things will really help improve your blood pressure, improve your diabetes control entering into pregnancy, and then throughout pregnancy itself. And I think then really for women with diabetes, it's about really developing relationships with your diabetes team and your diabetes midwife, and being really honest about sort of diet and lifestyle and how we can control those sugars, because we know that if diabetes in pregnancy is poorly controlled, it can lead to babies being born big and having problems, and babies needing to come early. So the better control we can have over diabetes, the better, not just for pregnancy, but for your later life as well. So the other thing that's fascinating about pregnancy is that because all of these changes happen, it really does stress the body and almost gives a window into what can happen in later life. So we know that if you develop gestational diabetes or blood pressure problems in pregnancy, you're more likely to develop them in the future. And we know those issues are real issues for our communities. So there's no better time than pregnancy to really get on board and work with your healthcare professionals to get things controlled.
And just on the note, just Wolverhampton, we do also have the Healthy Pregnancy Team, which if you've got any concerns regarding diet or how to have a healthier lifestyle, like we said last week, you can access the Healthy Pregnancy Team. So you can ask your midwife to refer you, or you can self-refer as well. But you've hit the nail on the head, Beryl. It's really important to control diabetes in pregnancy.
And I know, it is really important, but it is possible, like I say, exercise and diet is really helpful. And there are medicines we can use in pregnancy. We can use tablets, we can use insulins. And for some women, we may need to do all those things even for a short period of time. But it's all about getting that control so you're well and baby's well.
I think in pregnancy, I find when women do become gestational diabetic, they become quite serious about their health and they're really quite committed and they want to learn more about what foods they can eat, what foods to avoid, how exercise can reduce blood sugars.
So exercise can reduce blood sugars, even walking after meals can reduce blood sugars. But I think the important thing as well is that I've noticed with some women, there can be a lot of shame that can come, they think that they have failed because they have developed this problem. And some people may perceive something like diabetes as being a because that it's related to food and it's an issue because they didn't have control. And I really want to reassure women, and not just women who are pregnant, but women who are going to be supporting women that are pregnant, sisters, aunties, cousins, mothers. It is not about shame here. It's about accepting that actually our communities are more at risk because of our genetic profiles.
Yeah, more susceptible, aren't we?
Yeah, and there's lots of complex reasons for that going back many, many years. But it's not about shame. I think we need to really destigmatize some of the shame that comes with developing certain medical conditions. But just channel things into action. As you said, it's a really good time to get in control of your health. And there are little things that we can do.
And keep those healthy habits.
Because that healthy habits transmits to your children.
It does. So, while we were talking about food, some ladies struggle a lot with sickness. So, I know it's called morning sickness, but it's not really in the morning, it's any time. So, what would your advice be to women who are experiencing hyperemesis or just that normal pregnancy vomiting in pregnancy?
I'm really glad you asked this question, because one of the things that really bothers me is that women don't seek help for this. So you're absolutely right. Because of the hormonal changes, particularly in early pregnancy, but for some women throughout pregnancy, they can get severe nausea and vomiting. And for some women, they don't vomit, but they get severe nausea. And it is so debilitating. And it can really affect their physical health. It can really affect their mental health. Because if you're nauseous all the time, you're not getting enough food in, you're not getting enough fluid in. That can influence baby's growth. And it can also actually influence your maternal well-being and weight and all of your own vitamins and nutrients that you need. And I've seen women become seriously ill because of it. So what I would say is that actually there is lots of treatment for nausea and vomiting in pregnancy. And these days we've got the new treatment that is basically vitamins that is first line. It's called Zonvia.
Oh, this is new to me.
Yeah. Zonvia is now first line in the new Royal College guidelines for treatment of nausea and vomiting in pregnancy. I've got 3 or 4 other options I can treat women with.
Yeah.
But if women have got nausea and vomiting in pregnancy to the point where they're really debilitated, the sooner you can get medication, the better. And your GPs should be prescribing Zonvia.
So it's a fine line, isn't it? Because a lot of people will reassure pregnant women, as we've been saying, being told, oh, it's quite normal, it's just pregnancy vomiting. But when would you know it's a fine line to actually it's a bit more serious?
So if it's the point where you're vomiting several times a day or so nauseous that you can't eat your meals, that you're dehydrated, that your mental health is suffering, that you're unable to go out and look after your children, do your job, all of these things are debilitating to the point where it needs treatment. I have sadly seen women go untreated and develop problems because they've had such severe nausea and vomiting. It increases the risk of blood clots. It can increase the risk of other metabolic problems. And sadly, some women's mental health suffers so badly because they become so isolated and they can't work. And that feeling of nausea is a horrible feeling. So I strongly encourage women to seek help. A lot of old wives' tales are like, if you have some adrak, ginger biscuits, these things, that's not an effective treatment.
Yeah, that's reassurance, just if it's normal, mild vomiting. Thank you very much. We will be back after the break with the second episode, the second part of Maternity Matters, I should say. See you soon. Hi, I'm Sunita Banga and I'm talking today with Dr. Parul Prinja. So we're here talking today about pregnancy on this week's Maternity Matters. So Parul, we were just talking about accessing healthcare and hypertension. We were talking about, hyperemesis. We were talking about sickness in
Yes.
pregnancy. So I just wanted to bring the conversation onto recognising what's normal regarding heartburn and when people should be worried. Is it heartburn or is it chest pain? Because sometimes when women vomit a lot, they do say, I'm getting a lot of pain.
Yeah.
So if we could just talk a little bit about that.
Yeah, so it's tricky. If you usually have heartburn and it feels like that same heartburn, and you vomit a lot and the pain is a burning pain that goes into the back of the throat, and if it's worse when you lie down and you don't have other symptoms of concern like significant breathlessness or feeling dizzy or lightheaded, then it probably is heartburn, especially if it gets better with things like Gaviscon or antacid tablets like omeprazole, then it's probably heartburn. However, it can be tricky. I've had really bad heartburn and I thought I was having a heart attack because it can be so painful. So I would just say to women that if you're unsure and you think, gosh, this is out of the ordinary and it's not getting better with things like Gaviscon, then seek urgent medical help, because actually some heart problems, such as having heart attacks, can feel like indigestion, and I can see why it's very tricky for people, which is why when people come in and they say, I've got chest pain and I feel like I'm wasting your time, I'm like, it's not a waste of my time at all. Like, it's my job to fully check that everything is okay. And we know that one of the leading causes for, sadly, why women die in this country is due to blood clots in the lung, and due to and due to heart attacks. So what I would encourage women is that if you think it's heartburn and it's not getting better, or it's not like your usual heartburn, you must come in. But also you've got to think about your own risk factors as well for having heart. So normally, I think you've all seen on the television, you get a heart attack, you see people, they clutch their chest. Sometimes the pain goes down the left arm and goes into the neck. The reality is, in women, it doesn't always happen in that textbook manner. And it certainly in pregnant women and women in our community, it doesn't always happen in that textbook manner. It may be just a bit of indigestion like pain. And certainly, every time I think I assess a woman, I always look at her as an individual, but in the context of her risk factors. So I always ask questions about their family history. So if your parents have had heart attacks or at a young age, or have blood pressure, cholesterol problems, and you yourself have other risk factors for having a heart attack, and those can include having high blood pressure, smoking, having cholesterol problems,
It's a big
and having it in your family at a young age, then pregnancy may sadly unmask those problems for you.
Yeah, it's quite important to know about your family history, isn't it? And we were just talking in the break. Sometimes when we're doing a pregnancy booking, we ask a lot of questions about the pregnant woman herself. And it's really important that she does know the family history and she's able to let us know, because that would indicate her risk factors.
I mean, spot on. And I think this goes back to pregnancy planning. So if you're planning a pregnancy, find out all these things beforehand, because you may find that actually you're at risk of certain things, and you can then anticipate problems before they happen. But certainly not just family history, but even your own history. Did anything happen to you when you were a child? What was your birth like? Were you in and out of hospital at an early age with any problems? So it's a really good opportunity to ask family members and get that information about what happened in your own childhood, as well as your parents and your siblings, because that can be very, very relevant to you and your own individual risk of developing problems.
It's so important.
Yeah, and I think, sadly, especially as the world is getting bigger and our parents aren't always either around or in the same city and things, it just becomes more and more important to gather that information, and so you can empower yourself. It's important to know, what happened to me as a child. What were the issues? Do I need to worry about them? Do I need to worry about them for my children going forward? Is it something that it was just a one-off? I had a chest infection and went to hospital, or actually, could there be a problem that will affect my children? So information really is power.
It is. It really is. I think regarding mental health as well, sometimes people may have had an episode of psychosis, or something may have happened where they're quite shameful about it, especially in the Asian community. A lot of people don't like to admit that they've got mental health problems, and often that may be concealed information from your children. And I've definitely spoken to women, they've said, I think something happened with my mum. I remember something, but I don't know what. But these key messages are really important to find out that you do know the full history of what happened, because it could be that it may affect you as well in your pregnancy.
Yeah, and I think I'm glad we talked about. I mean, I mentioned it before when I was talking about other things, but particularly with mental health, I really do think we need to destigmatize this shame element of it, because those issues can happen to anyone.
Absolutely.
Anyone. It doesn't discriminate against anyone. It could happen to anyone at any time, and we as health professionals are really aware of that, and we just want to know so we can support.
What would you describe as normal emotional changes in pregnancy regarding mental health?
So, pregnancy can be an emotional time. There is
It
no
is.
getting
It
away.
certainly
There is
is.
no getting away from that. But things that aren't normal are if you are tearful and if you are down consistently, if it interferes with your day-to-day ability to do things, if you have lots of negative feelings that are persistent, and sadly, if you have feelings of wanting to harm yourself or harm other people, if you're hearing voices and things like that, either in pregnancy or after pregnancy, you must seek medical attention, because this is so important, and we really want to support women, and not just support women and offer them psychological support, but in some severe cases, medication may be needed. And medication, we can use medications such as antidepressants and anti-anxiety medication if that's the right thing to do in pregnancy, because sadly, we talked about in pregnancy, women die of blood clots and heart attacks as the leading cause. But sadly, women in the postpartum period, sadly, the leading cause is suicide. And we just, as a community, need to talk more openly about mental health problems. So my practice is to always ask women how they are.
Yeah, I think it's quite underreported as well, because when you've had a baby, most women feel like Superwoman and they want to do everything and they don't want to admit that actually I am feeling a bit low. I am noticing a change in my behaviour and how I'm feeling. So who should they be talking to, or where can they access help?
So they can access help through the health visitor and midwives that they see in the postpartum period. They need to see that they can see their GP to access mental health helps. But if they are in a crisis, that there is a crisis in the middle of the night or on the weekend, they must come into the emergency department. I remember this vividly, actually. I will never forget it, and it's one of the reasons I trained in the specialty I did. I remember when I was a trainee doctor, I saw a woman from our community come into the emergency department postpartum, and she could only speak Punjabi. And someone kept trying to speak for her and say, she's got a bad head, she's got a bad head, she's got a headache. So she was investigated with all these tests to do for headache for 2-3 times. And then I saw her coming in, and I could speak her language. So I just thought, I'm going to speak to her alone. And it was clear within 5 minutes of the conversation, she was having harmful thoughts and she was low in mood. But she kept pointing to her head, so everyone just assumed it was a headache. So we must ask the questions, and we must ask it in a way, not just a language that a woman can understand, but leaving space for actually someone to be open about their feelings in a non-judgmental way.
I think on that note, just using interpreters for any language.
Yes.
You speak Punjabi, your patient was Punjabi, but it could be any language. And I think it's really important as health professionals are accessing interpreters. We've got lots of facilities in the hospital. You can get them on the video, use the telephone, face-to-face interpreters.
And I'm really glad you brought that up, because I would actually empower our women to ask, and not just ask for an interpreter, but sometimes they'll come in with a family member, and the family member will do the interpreting, but sometimes it's not always an accurate interpretation, or they may not be, because I've seen it in the Punjabi language, they may put their own spin and opinions on it very unintentionally.
They mean well.
Of course they mean well. But sometimes we just need to make sure that the messages going across are exactly what we want, and we're truly hearing the voice of the woman, because sometimes I may, and I've done in certain circumstances, kindly ask people to leave so that actually it's a safe space for the person to say what they really want to say. So I would really strongly encourage our women, these things are available for you. You are not bothering.
And they're free.
And they're free. Please just ask for it.
I think, especially when it comes to medical jargon, that will just get lost in translation.
Yeah.
So if the person who is being your advocate and speaking with you, for you, if they don't understand all the medical terminology, you are going to get mixed messages, and you're probably not going to understand the risks that are explained to you or any medication that's been suggested. So it's really important in some situations. Although your family mean well, we know they love you, we know they want to do the best for you, but sometimes it is just worth having an interpreter, for sure. Mental health. So, if, let's say, a lady is noticing changes in herself, but she sometimes might be in denial and she doesn't want to speak up or access that support, if friends and family around her are noticing any changes, what should they do? Because sometimes I've definitely met women who are saying, no, I'm not fine, I'm okay, I haven't got any mental health problems. They're really adamant that they're absolutely fine.
So now I'm interested what you do. What would you do?
I would encourage, I mean, my role, I have a lot to do with, I encourage dads to come to the sessions and I tell them about this. In Wolverhampton, we've got Dad Pad, which tells you what to do, which is basically if you are seeing your wife or partner deteriorating mentally, that if they are not accessing the help, then you can advocate on their behalf. So you can either get them to A&E if you can, or speak to the health visitor or make a midwife appointment, depending on how many days postnatal you are. But it could be antenatal.
Yeah. No, I completely agree, and I think this is why this show is so great, because it's not just for pregnant women.
Yeah.
It's for anyone
family
that comes into contact with pregnant women. It may be your friend, it may be your sister, whoever, that actually you can advocate on their behalf, and it's so, so important because they may not be able to advocate for themselves.
Yeah, that's really crucial messages there. So how would you what support is available for people with mental health? So we spoke about medication.
Yeah. Well, there's a perinatal mental health team. So, regardless of location in the UK, there are nurses and mental health professionals that are trained to deal with mental health problems in pregnancy, and there can be talking therapies as a result of the referral. You know, I would strongly encourage that if you feel that something is not quite right in pregnancy, but you're not experiencing those severe self-harm things, if you feel low to the point where it's really affecting you, you can ask for that referral and your midwife will offer it. And sometimes you may feel, okay, I don't want it quite now, I'll see how it goes, but you can always pick it back up and be referred to those services who can assess you and then work together with what's best for you.
I think if it's low-level mental health, there is a lot of support in Wolverhampton and Walsall. So you can ask your midwife, you can be referred to local support groups. We've got the ACCI, which is the Afro-Caribbean Community Initiative. They do lots of work with low-level mental health. There are other services. We've got a healthy pregnancy team as well. But also, I think sometimes if you've got children already, just making sure that you're getting out of the house all the time and going to your baby groups, etc. You need to get out of the house, because if the more you stay indoors and you isolate yourself, your condition probably will get worse.
Yeah, but that can be sometimes very difficult for some women in our communities. You know, if they have responsibilities, if they have jobs, if they've got to look after their other babies. It's really important. I think the more and more work I do, just how important it is to sort of actually prioritise your own well-being. And sometimes you may feel that it is a little bit selfish to do that, but actually it is so, so important to say, do you know what, actually, I just need a bit of space to go for a walk for half an hour to clear my mind, or go to this support group because it's important for me and my well-being, because it's that old adage of you can't pour from an empty cup. If you're not well, you can't look after your family.
You have to look after yourself.
If you're not healthy, you mentally or physically, you can't look after anyone else. So I've noticed that's a real issue in our community where we put everyone else first.
Yeah, you have to look after yourself. I'll use this analogy often, and it's when you're on a flight, for example, they always tell you to put on your oxygen mask first. You have to kind of think like that in pregnancy. Well, generally.
Well, in life, but pregnancy, it's almost more critical, isn't it?
It is. So we were talking about walking. What other exercises would you recommend in pregnancy? What should women be doing to keep themselves fit and active?
So I would really encourage women to stay as active as possible in pregnancy. So I know some women actually who've, done lots of training and weight training and running before pregnancy, and unless there's an issue, and if their obstetrician says it's fine, you can probably continue all of that in pregnancy. And there are some women that do, and that's great. Now, I think if you've never exercised before, you can start in pregnancy.
Yeah, you can.
So you absolutely can, but even simple things. So going for a walk, half an hour, at least 3 times a week, even every day. I know in the UK we are really troubled with the weather, but even, walking is such good exercise. Getting a decent amount of steps in, that's realistic and doable, doesn't require a gym subscription. Yeah. So that's some ways to start. Swimming is also very good because it can be really good for women who have a lot of pelvic pain in pregnancy. Yes. It could really help strengthen the core. There are exercises you can do. You can look up online on how to strengthen the core, almost like Pilates. I'm not saying you should go to a Pilates class, but you can do things that really help strengthen the abdomen and will help reduce pain in and around labour. And then if you want to do other sports and activities, by all means, as long as it's non-contact and your obstetrician's okay, more than happy for women to exercise.
Yeah, we've also got our pelvic health service as well, so that's the PPHS service in Wolverhampton, perinatal pelvic health service, and we're doing antenatal pelvic health sessions every 2 weeks in the community. So if you have a look at their website, PPHS Wolverhampton, you should be able to access those as well. And they're also doing those in different languages, so we've got them
that's
every
really
2
good.
weeks
Yeah.
in our top 5 languages. So what would you say would be the safer tips for exercise regarding keeping hydrated and making
Yeah.
sure you've eaten perhaps?
Yeah, so
things?
absolutely. Make sure you eat before you exercise. Certainly you're well hydrated, that you take water with you.
Yeah.
And listen to your body. You know, if you're doing a bit of a walk and you've done more than you usually do and it's too much, stop. You know, listen to your body. Don't push yourself just because you said you were going to do an hour.
Yeah.
You know, don't push
Yeah.
yourself.
I think that's the key message, isn't it? Listen to your body.
Listen to your body, yeah. But you know, it is very good.
Okay. Yeah.
But not just for pregnancy, but then also developing and maintaining those habits after
Yeah,
pregnancy.
it's starting a good habit and carrying on with it. And when the
Also,
baby's
it's so
born,
good for your mental health as well.
Oh, mental health
Yeah,
and
yeah.
postnatally as well.
Yeah.
Going for walks is good for, again, your mental health, but also keeping fit and active yourself. So would you say you've got any closing messages at all, Beryl? Anything you want to mention before we
I
finish?
just hope
We're
that-
nearly done.
Yeah, I just hope that women know that, you know, we are there for them.
Yes.
We're both members of this community and we want the best for our women, and that we're here to listen to them. And I just want to know, you know, if women have got problems, I just want them to tell me. And so that's the only way I can help if people are honest. I'm not here to judge people. Listen to your body, seek help, and make sure you advocate for yourself and stand up for yourself. And if you think something's not quite right, you know, politely say, you know, I'm not quite happy here, or I'm not sure what's going on. Please, can you explain it? Because it's your body, your health, and your family at the end of the day.
Absolutely.
And we want the best for you. So those would be my sort of key messages, although there was a lot of science wrapped up in there over the last hour, I'm sure.
No, those are really, really important messages. Thank you very much for coming on today.
Thank you for having me.
I think we've just going to, if you could just go over when to contact the hospital if you are worried about anything, please.
So certainly if you get abdominal pain, if you get any bleeding, if you get any pain in your tummy, so particularly on the right side, if you get a severe headache, if you get breathless, if you get chest pain, if you collapse, and if your nausea and vomiting is out of control, please do contact the hospital immediately. And it might be that you have to come to the emergency department in those cases.
Yes, that's fine. Thank you very much. So we will be back next week. We will be talking next week on Wednesday with the infant feeding specialist midwife. So if you've got any concerns or questions or any information that you would like about infant feeding, that's what we'll be talking about next week. Again, Beryl, thank you very much.